Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Please do not message or call, as the following programme is a rerun of a previous live show. Any announcements made during the repeat may now not be applicable.
Assalamu alaikum to the listeners and viewers. Welcome to another exciting and educating edition of the Health and Fitness Show. My name is Sulaman Rafiq and I'll be your host for today, shortly joined by Fahad, Matin, your regular host. We hope and pray that all of us are fit and healthy by the grace of Almighty Allah, and we have all had a nice and positive week so far. This program is broadcasting from the studios of Inspire FM live today on Thursday, the 17th of January 2019 at 6 p.m, casting its positive vibes to all the lovely people in Luton and surrounding areas such as Dunstable, Harpenden, Bedford. And our positive airwaves are also reaching listeners who are listening to us at the Inspire FM app or website. You can also view us via Facebook. All you have to do for that is go to the Inspire FM Facebook page and click on our live link. If you are listening to this show on Sunday or any other Thursday, then it is a repeat. So today we always cover different topics, and today's topic is Blue Monday. Yes, you heard me correctly. We'll be talking about a fairly recent phenomena of Blue Monday. And in fact, you may have also seen that Samaritans have a campaign called Brew Monday, based on having a cup of tea, and maybe we'll be touching on that later. So you may be wondering, what is Blue Monday specifically? So let me just quickly cover that. So from what I read briefly, is on Monday the 21st of January, so the coming Monday, which is the third Monday of January, has been awarded this gloomy title of Blue Monday due to a combination of post-winter holiday blues, cold dark nights, and it's cold tonight, and the arrival of unpaid bills. I'm sure our listeners are going to have thoughts on this, so why not get involved by calling 01582 481 822, or you can text or WhatsApp us on 0777 948 1822. I'm delighted to say we have a range of fantastic guests. Firstly, in the studio, we have Jolel Miah, who is founder of Our Minds Matter and the Chair of Trustees. We have Maria Weiss, who is psychological wellbeing practitioner for the Total Wellbeing Service here in Luton. And on the phone, we will be having Neil Wood from Public Health England, Health and Wellbeing Programme Manager. So good evening to you both.
Good evening.
And could we just start by just giving us a little bit more detail around what your roles are within this area of work? Jolel, can I start with you?
Yeah, so our work involves providing mental health education from the charity Our Minds Matter. My background is specifically in psychology, so I've been studying and working in this field for almost like now 13, 14 years, when you add it all up together.
Yeah, fantastic. You don't look that old.
Yeah.
That's a long time. And Maria, could you give us a little bit of background?
Yeah. So, as I said, I'm one of the psychological wellbeing practitioners for Total Wellbeing Luton, but I'm also one of the team leads for the service. And a bit like yourself, I have also a background in psychology, and I've been doing psychology when I counted up for pretty much similar time also. So that's a little bit about
Fantastic. So we've got a lot of experience in the studio, and I'm delighted to say that my co-host Fahad Matin has joined us. Fahad, would you like to give salam to the audience?
Assalamu alaikum. I'm Fahad Matin. Everybody knows me, and I will be co-hosting today instead of being in a hot seat because my lovely friend is on the hot seat.
Fantastic. And I'm delighted to finally introduce us to Mr. Neil Wood from Public Health England. Neil, could you just give us a bit of background around your interest in this area?
Yeah, so I work for Public Health England. I'm a health and wellbeing programme manager, and amongst my policy leads, I've got mental health and things like health and work and tobacco and smoking. And I have to say, with those policy areas, I spend most of my time talking to people in the context of mental health.
Interesting. And so today's title is Blue Monday. And Neil, can I start with you? Is Blue Monday, what is Blue Monday? Is it just a bit of a marketing thing, or is it an actual phenomenon?
Well, very good question. Were you to consult the International Awareness Events calendar, it might suggest to you that a university professor managed to calculate the most depressing day of the year, and that being the third Monday in January, and using a combination of factors around post-Christmas blues and the dark nights and arrival of the post-Christmas credit card bills and all our failing New Year's resolutions. But actually it was a marketing ploy. And it was used as a PR stunt by a travel company back in 2005, and seems to have stuck over the years. So quite frequently, we are kind of reminded that the third Monday of January is Blue Monday, but there's, as I say, there's a different kind of story behind the marketing stunt.
Interesting how marketers can latch on to health and wellbeing topics as well. Just out of interest, given the dark nights and the short days that we're experiencing in the moment, maybe some people out there are feeling a little bit low. And what would the general advice be from Public Health England around that?
Well, I think one of the things that we kind of consistently refer to are the 5 ways to well-being, and I think if you look at a number of websites for Mind and the well-being services locally, they refer to the 5 ways to well-being, and I won't go into the detail, but that's about connecting with people, and avoiding isolation. It's about being active, and you don't have to go to a gym to be active. It's about learning new things. It's about giving or volunteering. And the final thing is just about, I think, taking a little bit more notice and being a bit more mindful around the present and the things around us.
And that's really interesting. And where would we go to find out a bit more information about some of the things you touched on?
At the moment, there's Public Health England is working on a campaign called Every Mind Matters. Now, if you and your listeners are aware of Public Health England's One You campaign, and just simply Google One You and find that website, you'll find that the Every Mind Matters campaign is on there as well. That's currently being, I would say, piloted in the more broadly in the Midlands to kind of make sure that everything that sits behind it works. But actually, there's nothing to stop you accessing it now. And the resources on there, and all of the links work. And if I put in my postcode, I live in Suffolk, and it will find support in my local area that I can access. And there's a whole raft of kind of resources and support and help already on the website, and it will develop a little bit further until it's more widely kind of launched to a much wider audience.
That is very interesting, Neil. Hi, it's Fahad. But we do have a local group as well called Our Mind Matters, and we have one of the representatives from that organization, Joel. So, Joel, in your opinion, what's the difference between the mental health issues and the depressions you see in the public, especially the people of Luton?
I think for us, it's mainly, there's a difference between illness and health. So you got to separate out the first kind of issue. When you're talking about mental health, when people think mental health, they automatically assume mental illness. And, so we all have mental health, but all of us have mental illness. In terms of Luton, we have that problem around languaging. So I think languaging is a big part of actually, no, actually it doesn't belong to me, it belongs to you. You're the one with the problem, not me. But in fact, it's a bit like having flu, isn't it? You can get it any time.
Exactly. Absolutely correct. So in terms of the depression itself, is there any way you, as an organization, have any plans to tackle them?
We introduced depression as a normal thing to have, because you go through a lot of life experiences and situations, and you might experience certain symptoms which might develop into depression. So we tried to look at how common is it that you get a cough or a cold or a virus and anything like that. We don't say it's exclusive to people. Anyone can get depression, and depression shouldn't be in a way as if some sort of HIV or anything like that. It should be, it's a normal way of life, because we've got more than 20,000 cases of depression in Luton, which tells us actually, hang on, it's quite a normal part of life.
20,000 cases of depression in Luton.
Whoa.
Yeah, it's very common. That's with any, I'm sure.
There's a place which I've read that every single human being have gone through depression some part of their life or some time in their life, and in a year 1 in 3 people have suffered depressions during the year time. So yeah, it is quite wow kind of figure.
And if maybe we have some listeners who feel as though they might need some support, Maria, what's the best way of making contact with the local service?
So in terms of making contact with our service, Total Wellbeing Luton, so basically in terms of our criteria, anyone above the age of 16 can be helped by our service, but they must have a GP registered in the Luton area. Okay, so anyone based on this criteria, we have several ways. We try and make it as accessible as possible, and we're part of improving the access to psychological therapies, so we make it our mission to give lots of different ways for people to come to our service and come into our service. So as I said, there are several ways of referral. So you can refer through your GP. You can call our service. You can give us an email. You can come in face to face to one of our centres. If you look up at the website, you will find our locations. I work at the one in Hightown, in the Active Luton Centre. But also any health professional. If sometimes people feel that they maybe are a bit too nervous or don't really want to kind of go themselves. So any health professional can refer an individual, a person, to our service. And I would suggest that they take a look at our website, which is www.totalwellbeingluton.org. Or if they want to call us directly, you can get us on 0300 555 41 52.
Can you repeat that, please?
I can indeed. So our website is www.totalwellbeingluton.org, and you can call us on 0300 555 4152.
Wow, okay, cool. In terms of our listeners, so let's, Sulaman, what do you think? Shall we involve our listeners as well? Because listeners...
You can get involved by calling us on 01582 481 822, or you can text or WhatsApp 0777 948 1822.
Definitely share your experience, or at least if you have a loved one who have gone through, or yourself in any way, shape or form gone through any of those stages, please get in touch with us either by phone calls or by text messages if you have to. In terms of the depression and prevention, I like to ask both Maria and Neil about it. That how can we prevent depression? Because it is something which is very, very odd and very ununderstandable when you are depressed and when you're low mood, and also how to differentiate between a low mood and a depression, because this is very, very odd and funny. So let's start with you, Neil, on the phone.
How can we prevent it? Yes. I think this is difficult. I think modern day life, we have so many kind of challenges and stresses that it's probably not surprising from time to time that we're faced with odd issues or a number of issues that cause us some concerns and kind of result in a low mood. I think how we and then people I think refer to the phrase resilience. And we probably all have a degree of resilience, but we probably also have a kind of a point at which our resilience can be severely tested, and that may result in those times when we experience kind of low mood and depression around stuff going on. So I think avoiding it is sort of very difficult unless you kind of manage to successfully avoid most of the challenge of life, of work, and of everything else that it kind of throws at us. But I think the key thing is probably not probably just trying to do something about it and either addressing the things that are causing concern or getting some kind of help in terms of ways that you can develop the coping mechanisms.
Mm-hmm. And in terms of the prevention and the services which we have in Luton, Maria, what services Total Wellbeing offer?
So thank you very much. That's a pertinent question. So the Total Wellbeing Luton service, it was developed and delivered in partnership between Turning Point and Active Luton. So we as a service offer one holistic service and a system of support. So they're directing people to services according to their specific unique needs. Mm-hmm. So after all, we are all different. And this is a service that recognises that physical and emotional health are undeniably connected. So the link between emotional and physical health sort of complements that sort of mental health and well-being together, and sort of vice versa. Mm-hmm. So that in terms is a bit about sort of what our service is and what we do. Mm-hmm. As I said, we are part of improving access to psychological services. So we're basically providing mental health services, and with our partnership with Active Luton, looking at the overall well-being of the individual, so emotional and physical health, in terms of helping people to overcome this and maybe helping them get to where they would like to be.
Interesting. So in terms of your services, Jolel, how's your services different, or you support the same clientele?
Yeah, I mean, yes, I think Maria makes a really, really excellent point around the links between emotional and physical health. For us as an organisation, we, I suppose, educate and tell them the difference. Actually, things like physical activity, release of dopamine and chemicals like can offset depression. But the key thing, we always say, look, if you want to prevent depression, it's like what Neil was saying. You look at the causes. How do you prevent, homelessness? How do you prevent poverty and things like that, which are the causes? The question should be focused on, well, how do you manage depression? Because I think once you have depression, it's something you don't really get rid of. And the clients that we work with are the ones that come in, they've had depression for more than 30 years, and it's just a case of managing it. So setting expectations for these individuals is crucial.
Mm-hmm.
Absolutely. And I'm conscious you made a point earlier on about how we use different terms, perhaps not always in the right way. And so obviously the title of today's show is all around Blue Monday, and we've spoken about low mood, but then we've spoken a lot about depression as well. And I'm just curious as to understand, having low mood versus what I think of as a layperson having depression, which is, clinical depression, you might be taking medication, etc. Whereas maybe low mood might be more common, but yet still a problem within communities. Can you just clarify, starting with Jolel, what the difference is between depression and low mood, if there is one, or am I right to use those interrelatedly?
I mean, mental health first aid look at depression as a clinical diagnosis, something you'll be diagnosed with.
Yeah.
So it is a serious medical condition. Low moods, the way we look at it in terms of anything can affect your impact of your mood. You can have the opposite, which is like really positive moods, and then you can feel really, really down and low because something's going to happen or something's happened. So I think the key thing is about diagnosis. One requires lots of support and help, but the right clinical diagnosis is essential with depression.
Maria, do you want to come in on that?
In terms of our service and sort of using the different terminology, we offer different therapies to help people, and we because we don't diagnose in our service, we would more use sort of low mood. And just on that point that you made, Joel, that you're right in saying that we would say that instead of can depression be prevented or can it be sort of eradicated, we would say that it can be managed and sort of improved through working through. We would in our service provide strategies to aid the emotional and physical health and core mental health of individuals. So if I can just give you an example of what we might use. So as a therapist, we would use something called behavioural activation. I'm sure you've heard of that yourself. And just instead of throwing the jargon around, behavioural activation is basically trying to get the client back into a routine. So whenever you're feeling low, you might stop doing the activities or hobbies that you like, you might be avoiding things, you might just not want to do anything. Sort of maybe withdraw and retreat back into yourself. And we know that the less we do, the less positive we feel. So it's a case of getting people back into the way of doing their hobbies and activities to help improve their mood and engage in activities to boost a feeling of sort of that pleasure and achievement, and then help people work towards their goals and maybe want to do more. And it's not just doesn't work at the snap of fingers. It does take a bit of work, but that's how we would sort of class it.
And funny thing is, sometimes GPs, and this is something which is completely personal experience I've seen working alongside with GPs. Sometimes clinical professionals sometimes do not easily understand the difference between low mood and depression, because they have a very short time to see the patient, and sometimes because of that small term or time frame mood switches, a person who's surviving or suffering from those mood fluctuations, they say that it might be an early phase of depression. So there's a very a difference between these two terminologies. And it's a completely personal opinion. There's no medical background in my sense. I'm saying in that way. But yeah, it is not easy for even a clinical medical person to diagnose then and there, because sometimes it take a while to understand the situation where a person is in.
Mm-hmm.
Interesting. And Neil, from the Public Health England, you touched on Every Mind Matters. Is that really focused on low mood?
The focus of Every Mind Matters, I think if we work, I think at any moment in time, what one of us is experiencing mild to moderate, kind of anxiety and or depression, and we're on a little bit of a continuum that our mental health or our well-being can move from being good to being, having some kind of more moderate problems to some of us having quite severe and enduring mental health kind of conditions. The focus, I would say, for Every Mind Matters is the two people that are kind of in the middle of those that have got really good mental health at one end of the spectrum and poor mental health at the other. And I guess what One U is trying to do is offer support for ourselves, but also a degree of helping us support others that might be in a similar kind of position. I think people with more serious conditions or problems obviously need more kind of professional help, but it's very much about self-help and the 2 in 4 that are kind of in the middle of the spectrum. Great. I would kind of identify.
That's really helpful. Let's pick up this again after the break. So time has flown by and we'll shortly be approaching the break. Please do not go anywhere. We'll be right back after this very short break.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. My name is Sulaman Rafiq, your host for today. I'm joined by the main man, Fahad Matin.
Assalamu alaikum. Assalamu alaikum.
Wa alaikum assalam. And we're also joined by a special guest, Neil Wood from Public Health England, Jolel from Our Minds Matter, and Marie from Total Wellbeing. Thank you very much for joining us on today's show, discussing the topic of Blue Monday. So this program is broadcasting live on Thursday the 17th of January 2018 from the studios of Inspire FM for all our lovely people in Luton and surrounding areas listening, and even listeners of Sheffield in Link FM. Good evening and welcome back. So just before we went on the break, Neil, you were just discussing the difference between low mood and depression and how it's important to try and get access to the best and most correct information, and that the Public Health England campaign around Mind Matters is a good way of doing that. Was there anything else you wanted to add before we had to go to the break?
Yeah, I have to say, I was kind of doing my homework this afternoon and just reminding myself what was on the website. And there's an NHS mood self-assessment on the system, which I completed, and it kind of came up with a kind of a scoring, I guess I would describe it, in terms of my my mental health, and in terms of some of the things that might concern me at any time. Once I'd completed the assessment, referred me to a range of resources. And it was just a really helpful, kind of reminder, I suppose, for me that the resources are there. And I would just encourage any of your listeners to Google One U, find the One U website, and then just click on the link that says Every Mind Matters.
That's extremely helpful. It's great to know that's available 24/7, 365 days of the year. And Public Health England are obviously one of the main partners in relation to try and tackling this issue for our country, not just locally. So it's great to have you joining us on today's show. I'm going to touch on a topic which I wasn't sure whether or not I was going to raise, but I am going to. And that's in relation to often depression is perhaps seen as lack of faith. And in fact, sometimes it's suggested that, if in fact you were a bit more, faithful, a bit more obedient in your religion perhaps, that then depression, wouldn't affect you necessarily. I mean, Fahad, have you ever heard that said, or am I...
Well, I must say, alhamdulillah, in some cases, whenever in Quran it says that when your heart is not in slightly low mood or not right, you go and seek help and advice from Almighty Allah using Quran and Sunnah ways, and you will find the way. And some people did find the way. Alhamdulillah, I did, at least. So yes, it is true in many different ways. In personality wise, yes, we definitely need the guidance of the holy scriptures from our holy scholars. Definitely people who know Quran and Hadith and Sunnah inside out, because then they can guide you properly. But definitely at the same times, we need help and support physically as well as spiritually. So when the physical help requires, we call Our Mind Matters, not Ghostbusters, definitely.
And Jolel, in your experience, have you had this kind of suggestion previously? Given your years of experience working in Luton, that actually, the real issue here is that it's due to a lack of faith rather than depression. Being any other reason really.
Yes, it's actually what our charity sort of targets. It looks at the connection between faith communities and towards their mental health. Now, one of the key points is it's not just about belief in God, but it's actually about telling you what faith is encouraging you to do. So things like having a good diet, being active, being connected with friends, and that's just across the different faiths. If you look at all the faiths, even including the humanistic approach, they look at things like meditation. So a lot of the actual therapies that we see today are actually embedded in faith guidance. So when people get confused, they think that you've got depression because you don't pray enough. Well, actually, hang on, let's step back. We're not robots. God has not programmed us to be robots. We have human consciousness, thinking, reasoning, rationalizing, and also social interaction. So there's things that all faiths are teaching us in terms of how to stay healthy and for our own well-being, and that goes from sleep to eating to exercise, and also adhering to medication when we need to.
Fantastic.
Indeed. And in that note, I must say, let's involve our listeners.
Indeed. I know some of you may already have some burning questions about our topic, and particularly the point that we just raised. So why not call us on 01582 481 822, or you can send your questions via text or WhatsApp on 0777 948 1822.
And if you're watching us on Facebook, you can send your questions to our Facebook page as well.
Absolutely, you can send in via Facebook comment as well. So I'm glad you kind of clarified some of the concerns that often people raise around that. And I don't know, Maria, do you have anything to add from your experience with the Total Wellbeing Service?
We cover a lot of communities and in terms of different faiths, and I would say that it's something that's very important to people, and I wouldn't really disagree with anything that has been said tonight. Faith is a very important thing. It's a very individual thing. And I suppose we have to be mindful that whenever, sort of as a therapist, whenever we're treating someone, these are very important issues in people's lives. And we need to be able to integrate that into a person's therapy and be mindful of, culture and their religion to kind of help them improve their mental health through that, if they should want to.
So it's reassuring to know that their faith is respected as something within 100%.
People's lives. We believe that anything that's important to you, we as therapists and as a holistic and integrated service, we will take on board anything that is important to you.
Fantastic. Jolel, do you want to come in on this?
Yeah, I was just going to say that there's some work being done in other parts of the world which looks at grandmothers and depression, especially in
grandmothers.
Grandmothers. Because what they do, they sit on the bench and they're from the Christian faith group. And what they do, they act as a point of talking to individuals about any problems that they've got. So in that sense, so it's part of what we call, the destigmatizing sort of environment. And by doing that, that offsets lower moods, things like depression, and also feeling quite low.
And in my opinion, if you ask, I will say that, I will go and talk to myself, because, of course, I need some expert advice, and who else can give me an expert advice other than myself?
Fahad, are you suggesting that you love the sound of your own voice?
No, I need the sound of clarity, and sometimes, and I must say, sometimes all a person need to do is to thrash it out, which in our, which is part of a kind of a sunnah where you do meditation, which is also known as Mukabra. No. I'm forgetting the exact word.
Maybe one of our listeners will be able to help by texting in.
Yeah, exactly, definitely.
Yeah.
So where you sit in a quiet place and reflect upon of your what you can do and what could have done, and it is, and definitely, and the best way of dealing with some of these things is to thrash out with yourself and ask your own opinion about it. Although sometimes don't say it out loud in the public, otherwise you will be being classed as the cuckoo people. People who are slightly mentally challenged. Sorry, I've used the wrong word. I can see Jalal is looking at me in the wrong way.
Jalal, you need to speak to Fahad. But educate Fahad.
At the same time, let's ask Neil. Neil, what do you think about it?
Well, I got a little bit lost.
What do you think about your own expert advice?
Well, I think I guess I think as far as mental health, it doesn't kind of discriminate. We're all perhaps prone to experience hopefully good mental health, but equally there will be other times when our mental health, we're not feeling quite so great, and I think sometimes there might be, you talked earlier about the phrase low mood, and I think that's a good one, because without a clinical diagnosis, we can't, I would never probably, try to diagnose someone as sort of depressed, or, and sometimes there might be a little bit of a danger that if we know a little bit too much, but we're not a clinician, that we're jumping to, kind of conclusions. But I have to say, I know a number of people at the moment that are experiencing poor mental health for a variety of reasons, because of bereavement, because of job loss, because of relationships, kind of breaking up. And I think some of it is, we can look after ourselves, I think, as much as we can. But I think it's really, really important that if we're struggling a little bit, that we don't keep it to ourselves. I think it's okay to talk about it. I'm a kind of a bloke of a certain age that's probably grown up with my certainly my family background would be something that we're quiet Cambridgeshire people at root, and we don't often talk about feelings and stuff like that. But I think it's important we don't keep it to ourselves, and if we notice that someone around is struggling, actually they might welcome someone to talk to, and it shouldn't be a conversation that we're shared of. If we can just simply ask people, how are you, and it doesn't have to be any more difficult than that.
Interesting. And when I was doing a little bit of background reading about Blue Monday, as I say, Samaritans have started a campaign, #Brew Monday, brew as in cup of tea. And one of the ideas behind that is that people have a cup of tea and have a chat. I mean, you mentioned there, Neil, it's good to talk. I'm going to just come to our studio guests. I mean, Jolel, is it always good to talk, or sometimes can you over talk about these situations and how you're feeling?
I mean, yeah, the movement is a disruptor, which is really good. So it disrupts, your normal everyday Monday. So it's there to instigate a conversation. Okay, look, we accept, we understand that if you're feeling like this on this particular day, it's good to talk about it. But yes, there can be, if you talk to, everything's done in moderation, isn't it? Mm-hmm. That's what, faith sort of teaches us. So I think you need to have yourself boundaries. Sometimes, you can't talk for 7-8 hours. That would be really, really exhausting, not just for you but the listener. Mm-hmm. So you have to, set some boundaries and some expectations. So I think, yes, it's good to talk, but also set some boundaries.
Okay, so listeners, it's good to talk. So why not call or text in? And you know the number. The text number is 07779 481822. And if you'd like to call, it's 01582 481822. So we touched on very briefly at the beginning that the 20,000, I believe, was a statistic. 20,000 people within our relatively small town suffer from depression. Have I got that right?
It's probably more.
Probably more. So that we're aware of. Is that the right way of saying it? 20,000 that we're aware of. And Fahad mentioned this statistic: 1 in 3 people at some point in their life would have experienced depression. And I mean, is it a particular problem within the South Asian community, do you feel, from your experience working here? Or, do we see higher levels of depression within the community, or not really?
I think, again, it comes down to, it's like what Neil was saying, and same with Maria. Everybody can get it in that sense. It's just doesn't affect just one particular type of community. But I should point out that sometimes when you don't, you might some Asians or some South Asians might mask their problem, might not seek help early, and as a result, the condition gets worse. Same with other ethnic minorities, and as a result, more likely to be detained under the Mental Health Act and might have serious mental illness. So I think there's some problems, but also accessing support and accessing help is one of the key barriers around mental health issues in South Asians, and that comes from within the population and also the disempowering services. So you need to address both.
Interesting. And I was intrigued because you've got a comedy night coming up. Is that right? Do you want to talk a little bit? I mean, comedy, this is obviously a very serious issue that we're talking about tonight, and you guys, Our Minds Matter, have got a comedy night coming up in Luton. Can you tell us a little bit about that, and why comedy? I mean, surely you should be doing something a little bit more educational, maybe?
Yeah, when we first introduced the concept actually came from the actual mental health champions. Champions are people with lived experience. They wanted to do something around comedy and mental health. Now, when we first introduced it, the partners around us were like, really, really, going into panic mode. We said, well, hang on, comedy is a normal way of life, and laughter and stress and how we deal with problems, we use that as a form of self-medication to help us cope. Sometimes in a healthy way and sometimes in an unhealthy way. So we've put in a comedy night to talk about the links between stress, laughter and mental health. Okay. And to say, actually, a lot of people, when you say, how are you, they might just laugh off what we call their mental health problem, just to mask some of the issues. But also others can be seen as a positive sense. Well, some people laugh just to cope in that sense when they're really, really stressed. So we've put on a comedy night to look at actually passing on some education, the psychology behind laughter, and because not everyone's going to come to a clinic, or not everyone's going to come to a conference, not everyone's going to come to a workshop. They're going to go into places like a dessert parlour, like a comedy night, maybe down the pub, I don't know. Things like that they do. You have to go to where people are. Absolutely. To talk about mental health.
And who's going to be your comedian? I know Fahad always brings a smile to my face. Fahad, have you got a job for the night?
No, I like to smile rather than make people laugh.
Oh, okay. So who? Tell us a bit more. Where is it? When is it? Who's going to be your main guy on the day?
Well, I wasn't asked for Fahad to be our special guest, but I think he's got the skills for it. But anyway, the main comedian, his name is Omar Hamdi. He's from Wales. He's done a few sketches for the BBC, and he said, look, I'll come down and help you guys. I really believe in this cause. Fantastic. And it's on the Time to Talk Day, which is the National Stigma Raising Awareness Day, which is on the 7th of February.
7th of February? What time?
The the initiative runs for the whole day, so anyone can get involved.
Yeah.
But the comedy night starts at 7 p.m. in the Galaxy at Cookies and Cream.
Great. And where can we find more information if you'd like to come down?
Your best bet is always follow, obviously, Inspire FM, because sometimes they are really supportive of our work and they retweet our work. But if you want to find direct information, then it's www.ourmindsmatter.org.uk.
Fantastic.
Well, I must say, one of Prophet Sunnahs is to smile on, and if you see somebody with a smiley face on, at least that will pass a very good and positive vibe to another person, regardless of whatever person's mood on the other side. And if you just keep a very nice, calm smile on your face, you at least lighten the mood in the room, isn't it? What do you guys think, Maria?
Yeah, I think a smile always helps, even if you're passing someone by in the street and, you're looking at someone, they look particularly down, you never know, that could really make their day. And it sounds like such a simple thing, or such, come on, Maria, that's not really going to give anybody a bit of help, smiling at them. And what if I don't get a smile back? Even if you don't get a smile back, that might change a thought that person has had, kind of thinking, right, I didn't smile back at them, but there's someone who is willing, stranger, to smile at me. You might have just helped them with a really big sort of maybe issue in themselves, or a negative thought that they have had. So I would always say that a smile a day is a really good one, and any more than that is a bonus.
Fantastic.
And it is quite nice for kids as well. So if being a parent, if you see your children with a smile on your face, and you, regardless of whatever problems you're facing through or hard days you have, if you go and greet your kids with a smile on your face, they will greet you back with a lovely smile on their face, and it creates a very unique bond. What do you think, Neil?
Do you know, I was just reflecting, back in October I saw Sulaman at a conference, and he smiled at me, and that made me feel immediately better.
As far as I remember, Neil, he didn't smile back. Neil never smiles when he sees me. He's what is this guy right now? He's going to get me on doing some...
Well, no, I think it's absolutely right. I do, also have a health and work as a policy area, and I can remember reading a report ages and ages ago, and it was saying, what do you most want from your line manager? And most people actually, apart from, the line manager saying thank you a little bit more often, was just, acknowledging people and smiling at them. So I think you're absolutely right. It can go a very long way.
Sometimes it's the simple things in life, eh?
It is, indeed.
Yes, absolutely.
Fantastic. And we just, at the beginning of the show, we touched on some of the benefits of being physically active, etc. Maria, as you said, Total Wellbeing, part of Active Luton, obviously a huge leisure provider in the town. What opportunities and how can people find out more about getting physically active if they feel that's a real good way of, preventing low mood and or depression?
Yeah, so I guess it starts with, as I said, I give our referral criteria, and I guess if you refer to us, you'll come in, you'll have a holistic assessment, and then one of the therapists will gather a treatment plan that is personal to the individual, and if you personally believe that sort of I don't want to deal with my thoughts right now, but the behavioural activation or some help around, maybe we do lots of things. There are things in terms of total wellbeing, total wellbeing we encompass Active Luton. So when I speak about total wellbeing, I'm speaking for both sides of the service. So we do talking therapies, smoking cessation, we do health checks, there's weight management, we help long-term conditions, we do exercise on referral and social prescription. And social prescription is where this sort of getting people active again, getting them help, getting sort of referring them to the different Active Luton sites, and getting gyms, maybe team sports, things like that, even like yoga and other wellness sports and activities. And I think it's all within that assessment. So what I would say is come along, you will definitely get a person-centred care plan that is available to you and your emotional health, your physical health and your mental health. So that's what we can offer.
That's extremely helpful. Thank you.
Not a problem.
Unfortunately, we're approaching the end of the show, and I'd like to take this opportunity to thank all of our listeners and our lovely guests in the studio, as well as Neil, who's joined us on the phone. If I could ask you very briefly, just to summarize a key message from tonight's show, what would that be? Jolel, can I start with you?
Depression is a normal way of life. You will experience difficult moments, and it's important to know how to manage them and also to share what you find helpful with others.
Thank you. Maria?
I think from a service point of view, all the individuals and people who are listening to this, you're not alone. So please don't feel that you are. There is always someone out there who you can avail of help from, especially with services like ourselves. So please don't be on your own. Come down, refer, get in touch with the ways that I've said to you. And also in terms of Jolel service as well and that comedy night, get yourself involved. But my important message is you're not alone.
Fantastic. Fahad?
Neil,
of course.
I would just echo that completely. Just add one thing: if you notice someone who might be struggling, just ask how they are, because you might just be able to help someone to talk about something that they're struggling to deal with.
Fantastic. Fahad?
All I can say is smile. It will definitely lighten the mood.
Fantastic. The time has passed so quickly. Many thanks to you for sharing those lovely words of wisdom. If you've missed some or any of today's show, don't worry. You can still catch us online or the Aspire FM Facebook page, or listen to our podcast by going to Aspire FM website by clicking the radio show link, Health and Fitness Show, or tune back on Sunday at 9 p.m. for the repeat show. Please do remember us in your du'as, and until next time, Assalamu alaikum.
Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.